All right, this is stopcock training. If you look at the stopcock like this, when the off goes perpendicular to the opening of the stopcock here. So this is now open. If you turn it either way, it closes off between here and locks the stopcock. You can turn it either way and do that. So what Shannon does at the end of the procedure, we have the suture coming out of the patient. So she feeds each end of the suture through the stopcock. And then cinches it down and locks it. And you can turn it either way, but what that does is lock the stopcock. This prevents you from having to dig in and cut the suture, especially on the obese patients where it's really hard to find this. So after 3 hours, what I usually have you do is come in, turn it perpendicular, release it, and then lock it back down. And that way you can check to see whether or not the patient's bleeding or not. If the patient's bleeding again, all you have to do is undo it, cinch it down again, and tighten it again. If by chance you inadvertently pull it out, it's no big deal. Just keep it perpendicular here and feed the sutures back through the opening. Now that absolutely has to be perpendicular, because if it's closed at all, it makes the hole through there quite a bit smaller. But it's really pretty easy to do, and this prevents you from having to dig in and cut. And if in the event you have bleeding after we cut the suture, it's not an emergency where we have to put in another suture at the bedside. All you have to do is push it back down and lock it again until the bleeding stops. Thanks.